Grant is going to talk a little bit about what we're doing at Rogers. Peter was going to talk about the healthcare industry and what's happening in the healthcare industry with regards to Microsoft and Teams Phone Mobile. And then I'll wrap up with a bit of a Rogers value prop. There's a capability to put questions or capture questions in the chat. So if you have any questions, please put them in chat. We'll try to address them as they come. If we can't answer them all, we'll follow up afterwards, and or we'll try to address whatever ones are appropriate through live. So I'll pass it over to Grant to get us kicked off.
Thanks, Steve, and good afternoon to everybody. Thanks very much for joining us today. As Steve mentioned, I'm responsible for product management here at Rogers for our collaboration services. So we've been doing a lot of work together with Microsoft, and we're quite excited to have this opportunity to talk to you folks about a couple of things. We're going to get very quickly to Peter and his material around how to transform healthcare with clinical collaboration tools and data insights, which is obviously very relevant. Prior to that, what we wanted to do is to just give you a little bit of an update of what we at Rogers and Microsoft are doing together to help build the collaboration around Teams and some of the tools that we're going to talk about today. So just very quickly, post-pandemic, the kind of communication challenges that all businesses and enterprises and organizations of all sizes are looking for is, how do we start to incorporate and support hybrid work in an efficient and a productive way in an environment that has various fragmented solutions in it. We all have different forms of legacy solutions that we're using for our communications and our productivity with our workforces. So how do we optimize those and bring them together in such a way that they can support hybrid work, they can support the specific requirements and demands of healthcare workers in our new kind of hybrid environment. So we have ways that we've been working on together on helping to eliminate that kind of solution fragmentation, fully support hybrid work, while at the same time, from an infrastructure perspective, always having an eye on cost and efficiency in terms of a new solution.
And I'm sorry to interrupt, but
yep.
You please hold on for one quick second. Looks like just need to. Yeah.
Okay, are we good?
Yeah, I'm good now.
Oh, you need to reshare.
Yeah. Not good.
Perfect. There we go. Okay, you can flip to the next slide. Okay, so last year in 2022, Rogers and Microsoft, we embarked on a 5-year strategic alliance. And that's actually a unique partnership that we've joined forces on, basically to work together to modernize those applications to help serve, enhance customers' digital experiences going forward. So we have a lot that we have in our roadmap and our plans. But one of the very first things that is the result of that strategic alliance is starting to work in our unified communications and helping to build new services that can directly get attached to Teams and help with productivity. So as a result of that, we were the first company in the world actually to announce Teams Phone Mobile. That is a way to connect to Teams with our mobile voice services. So brings together our reliable 5G network together with Microsoft Teams environment and Azure cloud services, basically to lay kind of that foundation for competing globally. We are the largest operator partner for Microsoft Teams. So we've been doing this for a long time. We service and support lots and lots of customers in Canada. So this is Teams Phone Mobile, and we're going to talk about it a little bit more, is sort of the first of many new innovations that are going to be coming out of this partnership that we have with Microsoft. It's grounded in a history of firsts, right? So like I said, we're the top cloud solution provider that's an operator in Canada. We support over 35,000 customers with Microsoft 365 services. So very much, part of our DNA. And what we've been working at is to actually increase the capabilities around connecting voice services to Teams, so that that Teams environment can not just for meetings, but it's the way that you make your phone calls. It's also the way that you link to your mobile services to better enable frontline workers, frontline employees, healthcare employees with a solution that's got the full advantages of mobility. So we introduced Microsoft Direct Routing about a year and a half ago. And then in 2021, we introduced Operator Connect as well as part of the innovations in this area, giving multiple connectivity options for teams. And last October was the third kind of connectivity option that we launched with Teams Phone Mobile. So I mentioned that we were the first. We're pretty excited about that. There's really only about 5 carriers in the world right now that are offering Teams Phone Mobile, and it's an exclusive from Canada, in Canada from Rogers. But it really ties that mobile device very, very tightly into Teams. Probably, after we've had a chance to hear from Peter, we may be able to think a little bit about, the benefits that Microsoft brings in terms of the data and the insights, and then the benefits that we can bring together in terms of making that a connected system that's highly valuable for your healthcare workers. Okay, so with that, I'm going to hand it over now to Peter, who's a Microsoft healthcare industry lead, to start talking about the transformation of healthcare with some of these collaboration tools. Peter?
Yeah, thanks, Grant. So I just want to make sure I've got control here to transition. Don't think I do. You don't have it in presentation. Do you want to put it in presentation live mode for me, Rika? Okay.
I'm just going to put it again.
Yeah, because I'm not able to transition. Thank you. So what I'm going to do is I'm going to talk a little bit about what Microsoft is doing in healthcare all up and give you a feel for the trends and where we're shifting to. And what that'll do is it'll give you a sense of how we're aligning with, with partners like Rogers to bring a lot of that, what I call clinical collaboration to the market. And, we're starting to see a lot of momentum with remote patient monitoring, virtual care, and we're really starting to see that really get entrenched in how we're providing better care to patients across the care continuum. And I think we're going to continue to see that trend. And the days of going in to sit in a waiting room and wait to be seen by a physician, we're starting to see a lot of different ways in which that can be enabled. And especially with elderly, right? You don't need to get them out of their long-term care facility, go see a physician. A lot of times we can enable that right in the long-term care facility with virtual care technology. And that's really started to take off, especially through COVID, right? We saw a lot of that happening. But what I want to do is just take you back a little bit about what Microsoft is doing and how partners like Rogers are helping us build out those clinical collaboration tools and really starting to light that up for the healthcare system. As we know, healthcare is still very fragmented as far as a lot of the data across the healthcare system. And Microsoft is really focused on aggregating a lot of healthcare data, building a lot of data lakes, and really starting to pull all that data together. A lot of major hospitals are building what we call large clinical data repositories and starting to pull all their data assets together. And if you look at what Ontario Health's mandate is how do we build a better integrated healthcare system? And Microsoft is doing a lot of work in and around that as well to be able to start to envision having the right data at the right place at the right time for the care teams to deliver care. And a lot of that care is shifting into community and home-based care. So how do we have that health record follow through to the bedside of where that care is being delivered? And these are a lot of projects we're working on with a lot of our partners today. So on the far right of this slide, you'll see the orchestration of care. And today we're delivering care through care teams, right? We're starting to see a number of individuals responsible for the care of an individual. You've got the family doctor, you've got potentially some physiotherapists, you've got some nurse practitioners, you've got PSWs, you've got family members. There's quite a group of individuals that are usually involved in providing that care. And many of them need to be informed at all times about changes to the care plan, things like that. So we're spending a lot of time building out what we call those clinical collaboration tools and really allowing that care team to communicate more effectively. And one of the most important parts of that is the ability to be mobile, right? As we're delivering care in different scenarios, in different settings, the ability to be mobile and have that information and then be able to communicate effectively is important. So if you think about what Microsoft is bringing to market with our partners is really a secure, compliant infrastructure. And a lot of what we're building that on is really based around the quadruple aim and the quintuple aim now with equity of care. But we've modeled a lot of our capabilities and services around engaging patients, empowering that care team to communicate more effectively, getting access to the right data, whether it's operational data or clinical data, and then really improving that clinician experience, right? We're seeing a lot of clinicians and physicians burning out, just nurses burning out. So we're trying to make it more efficient to give them the tools to do their job better. And Microsoft has launched this Cloud for Healthcare a number of years ago, but it's really a secure, compliant infrastructure that uses a lot of the platform approach to really be able to build connectors to drive interoperability using FHIR-based technology, and then really starting to do this in a secure, compliant way. We are GDPR certified, we're HITRUST certified, we're HIPAA certified. So we meet a lot of the compliance and regulatory requirements and meet and exceed PIPA in many cases as well. So if you think about what that looks like, Cloud for Healthcare is a set of capabilities in a cloud infrastructure. And you think about engaging patients, it means things like personalized care, getting insights on your health and wellness, doing some research and finding the right information at the right time about your care, building out virtual care platforms for clinicians to have that interaction with patients. Care team collaboration is so important within the walls of the hospital, but now we're seeing that to be extended out into community and home-based care. The ability to use teams and federate across multiple organizations. And what it allows you to do is look and see a person sitting outside your organization, just like they're in your organization. So you can see presence, you can have an IM or an instant chat with them. So a lot of functionality is then extended beyond the walls of that hospital out into that community and home-based care. As well as looking at a lot of the data, how do we start to look at the operations and being able to measure wait times, bed management, things like that. We're starting to build a lot of capabilities in that space through our partners. And then, we acquired Nuance a few years ago. The deal just finalized last year, but we're starting to see a lot of the artificial intelligence and the ability to capture conversations and between a clinician and a patient and start to make that part of the medical notes, but then also pull out all of the information on that conversation and really start to decipher what it looks like and bring artificial intelligence in to help create those notes and be able to get better insights on diagnosis and so forth. So a lot of advancements around data and AI, and we're starting to see a lot of interesting use cases around things like ChatGPT as well. So if you think about where Teams is being used widely, it's in and around virtual care, right? You communicate within your organization using the platform. And with COVID, we deployed a lot of different seats across Ontario, across the country, really to enable that interaction of the clinician with the patient. And we have something called the Bookings app and set up all the functionality. So then it becomes like a true telehealth solution. And there's been a lot of uptake like that as well. And we've actually been certified by Ontario Health, Canada Health InfoWay as a complete telehealth-based solution using that Teams platform to do so. So if you think about how we address healthcare and how we look at that patient's journey through the healthcare system, really it's important to really understand the flow of those interactions across the healthcare system. And that's really what Microsoft is trying to build out with our tool set is how do we give a framework and a platform that our partners and customers can leverage. So if you think about an outreach or engagement with your patient, what those interactions look like from a digital standpoint. You look at accessing information and setting up and scheduling and so forth is really another set of whole capabilities. And then in the bottom right here, you'll see that whole virtual care experience on, potentially monitoring the patient remotely, doing some sort of access to a care management or a care plan. And then really potentially even clinical trials could come into play there. And how do you enable that? And sometimes it's done virtually as well on check-ins and just see how people are adapting to different technologies or sort of different medications. And then you may have to communicate with other members on the care team. So there's a whole experience and journey map around that interaction from a virtual care experience and connecting with the teams. And then also, if you start to think about post-care, how do you start to look at wellness and management of that individual's health and wellness? So there's a lot of different aspects that we've mapped out. But the nice thing, what we're seeing is with the use of AI and a lot of the, what we call this no code, low code development of applications, you're starting to see an automation happen where if there's 5 things that need to be done, we can automate that process. So it minimizes human intervention. And we're starting to see a lot of that happening across hospitals is how do we automate a process? And that way there's less human intervention and less likely to cause errors as well. So we're starting to see a lot of uptake around that automation and workflow within the hospitals as well. And that Microsoft platform is being used to do a lot of that work. So this gives you a sense of a lot of different areas of where we're focused, but I'm trying to highlight some of those ones that are quite becoming quite important and where we're getting some good traction. So if you think about Teams as a platform, right, it's really voice, video, it's the ability to just start to communicate in new ways, right? We're delivering this webinar through Teams as well. So you've got voice, video, there's chat functionality. There's a lot of capabilities that are there just built in the platform. But what we've done is we've built out capabilities for frontline workers, right? You've got the ability to do shifts and location sharing. You can do praise and recognition depending on some of your coworkers to acknowledge some of the work they've done. We've got advanced messaging. So if you think about a physician who's in the emergency room and sees a wound and wants to take a picture of it, share it with a colleague and get a second opinion of maybe some infection that's setting in or something. The ability to do that peer-to-peer consult and annotate on an image is important. So doing that through texting is not secure and not compliant because that image is on the device. So if you think about doing that in Teams, that image stays on the server. So therefore, you meet all your compliancy and regulatory requirements about any sort of data moving outside the walls of the hospital and potentially onto different devices. So there's a lot of little things like that that allows Teams to be integrated into that workflow and start to really be utilized as a platform. You start to talk about virtual care, right? I talked about that a little bit, where that capability and the scheduling can all be done within the Teams platform. You start to look at role-based training, team-based training. You can roll that out with a series of videos and checks and balances to ensure that people have done the training and have adhered to it and signed off on it. You could deliver that all through the Teams platform. The other benefit too is it also integrates into some of the big HIS systems. So think of Epic and Cerner, trying to connect into their systems to allow that virtual visit to happen. And you can do that from right within Epic, for example. So lots of functionality, interoperability in the platform. But one of the main reasons why organizations are really starting to build their communication platform on Teams is because of the security and the compliance of the platform. During COVID, we saw a lot of deployment of applications and Zoom and Teams and all sorts of different virtual care platforms were deployed. What's happening now is organizations are coming back and looking at what's been deployed and then starting to realize they need to really ensure that the communication platform is secure and compliant. And Teams has a lot of dashboard compliancy, a lot of that built in. And that's really why we're seeing a huge hardening of these environments using the Teams platform. As I say, it's a little more complicated to get it implemented, but you do have the assurance that it's a secure, compliant infrastructure with all of the controls and a lot of the ways to monitor and really build in that advanced threat protection on any sort of data breaches of any kind. So that's really why we see a lot of the uptake around Teams, that once you start to look at hardening up those environments across the health system. So we talk about cloud for healthcare and what it means and how it could be delivered. And what we've done is we've built a secure, compliant infrastructure, and we've actually now put out a lot of prescriptive architecture. So if you want to do virtual care, here's some reference architecture that calls out all the technologies that's needed to help you start to implement that. And this is where Rogers can come in and help you look at architecture, put a plan in place on that communication, and then start to help you implement that and manage it as a service. So there's lots of capabilities on leveraging that platform. You start to think about remote patient monitoring and where we're going with that, and the ability to have and use prescriptive architecture that is secure and compliant, and then partners like Rogers can help you implement that across your organization. Again, touched on using Epic applications, using in parity with Teams to deliver virtual care as well. I touched on this briefly, but Teams is actually verified by Ontario Health as a verified telehealth solution. It also is verified by Canada Health Infoway as a approved telehealth solution. So that removes some of the barriers around procurement or any sort of ways in which you need to ensure that that product meets and exceeds a lot of the requirements around healthcare and delivery of telehealth. So I'm going to just talk briefly about some case studies. I think it's important to know who's using the technology and where it's being deployed. So what I'll do is I'll touch on 2 or 3 and then I'll wrap up. So if you think about Lakeridge Health, right? During COVID, they deployed a number of virtual clinics in order to address a lot of the COVID testing and ensure that patients knew where to go through COVID. And they stood up about, I think, 30 virtual clinics across the region. And all that was deployed on Azure using the cloud for healthcare and using Teams for communication and collaboration. So there's a great reference and use case around Lakeridge Health. I think the Durham OHT is using Teams as well. New Orleans or Orleans Hub is also using Teams. There's lots of different OHTs that are starting to use Teams as well for that virtual care and that communication. CBI Health, right, doing home care. They have about 13,000 employees and about 3,000 clinicians have deployed Teams for that virtual care and that in-home care as well. So another great reference for us as well. Newfoundland and Labrador, during COVID, they had to move a lot of employees outside the hospital and into home-based, and they still needed to have access to a lot of their hospital services and applications. So that was stood up for them in relatively short order and helped them streamline. There was like 1,700 employees that had to be moved out into home offices with still full access to the services. So there was not much disruption in how they interacted and did their job. You think about Ontario Health and what their journey looks like. They've actually standardized on Office 365 E5, which has the highest level of security built in. And they're using Teams across all the organizations that have come together. But they've deployed, I think during COVID, we did about 10,000 seats for a lot of their home care provider group as well. So lots of different use cases, lots of stories around healthcare and how we've deployed Teams. And partners like Rogers can help us implement it and make it real for you. So with that, I'll turn it over to Steve, I believe, who's going to take us through the home stretch.
Fantastic. Thank you, Peter. All right. Risha,
Yeah,
I think
I'm
you're back in
just-
charge or still in charge, right? Can we go to the next slide?
Yeah, for sure. Just give me one
There
quick
we go.
second here. Sorry.
Oops. All right, so where are we at for time? I think we're a little bit ahead of schedule here, but I only have about 5 or 10 minutes worth of stuff here, and then we're certainly open to questions while you have the entire team here. So I get to go back into the nerdy side of the technology, so Peter gets to talk about the beautiful clinical stuff. But so what is Operator Connect? Operator Connect, and so we've talked a lot about Teams and Teams applications, and I love all the material around how Teams can enable remote patient care and virtual visits and so on. Operator Connect combines the collaboration of Microsoft Teams with the call capabilities of a business phone and with the ability to manage it through the Teams admin center. It's pretty straightforward, but it's very, and we're more than happy, for those that are interested, we're more than happy to come in and demonstrate some of this stuff, how very easy it is to set it up and manage it through the portal. Absolutely drives reduced costs in some cases from traditional voice systems by up to 30%. Very reliable nationwide connectivity. I think Grant already talked about us being the first Canadian provider to offer Operator Connect in Canada. So maybe we'll go to the next slide. And this one, so there's a quick video here. I think, Risha, if you can set it up, we'll talk about some of the different calling plan options. So let's roll the video. I think it's
Yeah.
just a minute or two.
Yeah, it's just a 90 seconds video. If there are any audio concerns, please let me know and I'll just play the video.
Yeah, go ahead.
Voices have the power to foster relationships and build understanding. Microsoft Teams Phone can help restore connections and create new ones with colleagues and customers. Every organization is different, so Teams Phone offers a variety of options to suit every need. Microsoft Teams calling plans are a simple managed option from Microsoft to equip your organization with phone numbers, now available in even more locations. Operator Connect allows you to bring your own operator to Teams with a fully managed and integrated experience. This integration provides shared technical support and quality service level agreements, as well as direct peering for enhanced network resilience. Deploy calling with confidence directly from the Teams Admin Center. And of course, Direct Routing provides a powerful option to use your own operator and existing on-prem or hosted infrastructure to implement a tailored calling solution to Teams. Whatever approach you choose, learn more at aka.ms/Microsoft Teams Phone. Voices have the...
Oh, maybe we can go to the next slide. That's great. I love how we replaced me with a video. It's so much slicker and smoother. So we've talked about within that quick video, we talked about Microsoft calling plans, Operator Connect, Direct Routing. Then there's also Microsoft Teams Phone Mobile, and I think Grant started by talking about our relationship with Microsoft, our partnership with Microsoft, and how we were the first to provide Teams Phone Mobile. I don't think just in this country, but in the world. So there's a bunch of things, and it'll show up. There's a video in the next slide, which we'll get to in a second. But really, it's about creating a single number capability, simultaneous ring, native dialer, transferring calls to Teams, call logs, voicemail, and Peter, I think, also touched on enterprise-grade security and privacy. So maybe if we'll go, Risha, to the next slide, and it'll just kind of provide some of the functions and features of Teams Phone Mobile.
Microsoft Teams made more possible. And now with the workforce more mobile than ever, Teams Phone Mobile offers a next-level Teams experience, ensuring that wherever you need to be, a single number guarantees you will never miss a call. By utilizing Teams Phone Mobile, you will now get a simultaneous ring across all devices. Answering your phone using the native dialer will update both your presence and status. And thanks to the Uplift feature, you can effortlessly transfer calls from your native dialer to Teams without worrying about dropping the call. With a combined call log and voicemail, Teams Phone Mobile is connectivity redefined. With all these new features, Teams Phone Mobile offers enterprise-grade security and privacy. Online or on the go, never miss a call.
That's great. Thank you. And next slide. And this will be the last, and then we'll get to the questions. So why Rogers? And I think there's a couple things to talk about. I mean, Grant talked about the first to market on Operator Connect, first to market on Teams Phone Mobile, but being first doesn't necessarily mean everything. I think the key thing here, and particularly in healthcare, and one of the things I'm really passionate about, and we've talked to, I think there might even be some customers on the call that we've talked to about this. I love the concept of utilizing this capability for remote patient care and virtual visits. I've had some experience in the healthcare market over the years, and it's been a long time in coming. I think COVID has really allowed us to sort of push the envelope to start to get to virtual visits and remote patient care. For some of you folks on the call, and I recognize some of the names, you're operating in hospital environments that have a very, very broad geography of care area. And I think in the world that we're operating in today, we're not going to build hospitals fast enough to manage the patients. So what better way to take patients that are in hospitals and move them to home to either recover or in palliative care, or even just reaching the patients that can't get into the hospital for economic reasons or just the geography is so vast. Utilizing these tools for the capability of doing secure connect and remote patient care wherever it happens to be. One of the things that we're very passionate about at Rogers is extending our coverage areas, service expansion into very remote areas, including Indigenous communities and otherwise. And this is one of those areas through that telehealth that we believe that we can start to bring real equity across the healthcare community with this capability to collaborate anywhere, anytime. There's obviously some of the other benefits are simplification and scale. Again, if you're interested in double clicking in this, we're happy to come in and show you how it all works. We can do pilots as necessary. We can also show you the simplicity of the single pane of glass capability through a portal to manage your environments and be able to adjust your environments on the fly. And then finally, I talked about this earlier, but we see total cost of ownership reduction of about 30 to 40%. And we could show you some of the math in some of the situations. Sometimes it includes replacing other outdated collaboration capabilities. Sometimes it comes from eliminating old style telecommunications, voice systems, and otherwise. And so we believe that this is a great opportunity and advantage for the future. What's probably, I was going to say what's not on the slide, but it actually is right on the bottom. I just noticed. Most of you are well aware that Rogers continues to hold the provincial wireless vendor of record. We have hundreds of thousands of subscribers connected through that, through the relationship that you have with Rogers, that your hospitals are buying mobile phones. We have the contracting ability to add Operator Connect and Teams Phone Mobile through that very same contract. So this is easy to buy as well. And what we really start to see and feel is that the mobile device is becoming an increasing center point in patient care. Everything from, and I think Peter talked about, connections into the HIS systems, whether it's Epic or Cerner or Meditech, to the ability to do remote patient care and virtual visits. We provide a bunch of other capabilities wrapped around that, things like NetMotion and Checkpoint for endpoint security and so on. So all of those things are things that we'd be more than happy to chat with you about and show you how you can drive this work anywhere, anytime capability and collaboration and do it in a secure and private way. So with that, maybe I'll go to the next slide and pause. I'm not sure if there's any questions in the chat yet, or if anyone on the phone has any questions for any of our folks, particularly Peter or Grant, who are kind of the experts in this area. Are there any questions? And just speak out. Well, we must
Steve, you
have
did such a great job explaining it, right?
I don't know about that. I think you guys did. So we must, I was going to just say, we must have explained it so incredibly well. Listen, we're delighted to have all you folks join. If there's any interest in talking about this any further for your organization, here we have one question. Have it on our phone. What will the transition look? Should we adopt the solution? You're using MS Teams. Yeah.
Yeah, I can help with that. So actually, if you're you may be using Teams in one of multiple different ways, for example. So on your mobile phone, you can launch the app and you can place phone calls using the app. Some users, what they'll do is they'll use that within their organization, right? So just the way that you can quickly click on somebody's name and then open up a quick conversation with them. When we connect some of the connectivity services like Operator Connect and Teams Phone Mobile to your device, you can also make your phone calls in and out of the rest of the world, right? So call any telephone number or receive a call from any telephone number. So it expands it beyond just your sort of in organization on-net calling. And with the mobile option that we've been talking about, think of this, like a lot of organizations actually have, you have a work number, or, whether it's a clinician or somebody like that has a work telephone number, and they've also got a cell number. By moving into this solution or transitioning to it, you only have one number. It's always one number. It's your mobile number. You're reachable on that number, and then it's always like a work call. And so you have the ability at your fingertips to then lift that call from just a quick phone call that you've answered into a full Teams call and have access to all of the capabilities that Peter talked about. So that's sort of your gateway into all of that capability. From a transition perspective, it's very simple. It can be very simple because these different modes of offering connectivity can coexist within your same tenant. So what we've done with other users that have transitioned is, we identify, okay, which users does it make sense to have on the mobile application, and we can move them over seamlessly without impacting anybody else. So the nice thing there is that the Teams phone environment allows for us to connect mobile users while you're also potentially using Operator Connect users or even calling plan users.
So just, I'll give you some real world experience. I'm not a techie, but I enjoy the privilege of having the technology at my disposal. But we've been using the phone on Teams for probably a couple of years now, if I think about it. The one thing I love about it the best is if I'm in the car or mobile, I can take my device, and then as I come back to my desk, I can transition the call from my phone back to my device or my laptop. And so and if I've got to get out and go to a meeting, I can transition from my tab or my laptop to my phone and go uninterrupted, right? And it just transitions over. So there's a lot of very simple, really cool features that I've really enjoyed. And it really makes that experience seamless and work well.
I think Jeff Brown had a question, and then we'll go with Scott's question afterwards.
Yeah, I was just wondering, kind of with the right to disconnect that's happening now, if this is set up, is there an easy way for users to not have calls come to their phone? Is there like an on-off switch, or is this all or nothing?
Yeah, no, it's very good. I mean, there's definitely user settings that can be set within the Teams environment that can allow calls to forward to voicemail at off hours. And I know that there's actually more also coming in the roadmap that'll allow for a different number to be presented depending on time of day. So imagine where any call that you make or receive is to your work number during the daytime, and then to a personal number at a set time in the evening. So the answer is yes. There's absolutely ways where this can be controlled so that you're not too connected, right? Or when you want to disconnect, you can disconnect.
Next question is here from Scott. Is your one number your cell number, your office number, or a new number? And I'm assuming that probably has to do with keeping your contacts and that kind of stuff, so people know how to reach you.
Yeah, and actually, it's essentially selectable. When we sit down and we figure out, which users are going to move to the new new calling mode, it can be your wireless number. So the number is portable in, and this is how I think probably how Peter got set up as well as myself. So the cell number that I had now is my single Teams number. That's the one. It is also possible, though, if necessary, if somebody actually needs a new number, say it needs to be a separate number, that can be assigned as well. So again, a lot of flexibility in terms of what number we assign to a user based on your needs.
Yeah, so my experience is I have a cell number I've had for 20, 30 years, and I'm keeping it, right? It's my number everyone knows me by. So I'm loyal to that. I've kept my cell number. I also then have been given a Teams number, right? A new 289 number, right? Which doesn't really get publicized, but all my calls for coming through my computer or through Teams come into that with that number. But I still have my cell phone, and they all work together. And I prefer to keep it separate, just that way. It's just the way I work, right? So it has to have that flexibility. You can make it one number. You can keep them separate. It just depends on how you want to set it up.
But the office number can be ported, right?
Oh yeah,
as well.
And you
the office
so
number
cellular number, office number, whatever is preferred.
That's correct. Yeah.
I think Anthony de Guzman had a question, although the hand has gone down. Anthony, are you still there?
I am.
Thanks. So appreciate the presentation and everyone's comments towards. I'm more leaning towards the Operator Connect piece. I hear the mobile number versus the Teams issued. And you did talk about the security around it. So it'll be easier for, RFPs or whatever that comes through to qualify this as a solid solution. Operator Connect, can you just describe what that looks like if we do have distributed numbers that exist on a mobile device?
Sure. So Operator Connect is a connectivity option into Teams. It's actually not based specifically on mobile. Rather, it provides a number, and numbers are portable in and out of Operator Connect. But basically, all utilizing SIP technology and voice over IP. So in the case of mobile, we're actually leveraging the mobile number, of the device for the PSTN calling and connectivity. So depending on your users, if let's say, for instance, your user base is more remote work, but possibly fixed, less mobile, Operator Connect makes 100% sense to be the way that we assign those numbers. Again, fully portable. So if there's an existing set of numbers that they can be moved onto the service, or new numbers could be assigned from an Operator Connect perspective. Once you have that capability, you can call using your mobile through the app, right? And actually get to Teams environment and leverage your Operator Connect functionality to call in and out of the PSTN. The difference with Teams Phone Mobile is that you can make and accept calls right from the native dialer of your wireless device as well. And there's certain advantages associated with that. Does that help?
Yes, it does. Thank you.
There's sort of a two for one here about cost. So, and Peter, I'm going to ask you this because one of the questions is, has any Canadian hospital moved to this and dispensed with their on-prem PBX? And I think kind of a previous question, I can't remember what the name was. I think it was, Kristen, limitation for healthcare is cost. And I would say, I think what we tried to address in the presentation is that cost actually can come down. There's numerous ways to do that. In fact, Kristen, part of what we're looking at is most doctors and healthcare workers are paying for their own phones, or they're paying at market rates at $40 to $60 a month. Under the vendor of record, it's about $20 a month. And so we're talking to CIOs about moving towards vendor of record, which would immediately strip cost out, as well as some of the traditional PBXs and other on-prem devices are more expensive on a per seat basis. So we have very aggressive pricing for the public sector. So even when you layer on these calling plans on top of the mobile phone, we have a way to save significant dollars. But Peter, maybe you want to talk about any hospitals that have moved in this direction.
Yeah, no, when you think about Ontario Health and UHN, Sick Kids, there's got to be 20 or 30 that have fully deployed Office and Teams. We have probably about 80 to 90% market share in the Ontario market for Office 365. We've actually set up preferred pricing through OH. And then, Kristen, you've worked with Scott. You could probably get pricing for the hospital on your enterprise agreement that would set up that Teams pricing and get you on an enterprise agreement. And then what Rogers would implement for their services and functionality would be on top of that. So, we'd sit down, but, healthcare does have very aggressive pricing. And if, Stephen, if you've got preferred pricing in and around public sector customers, I think you're getting a pretty good price point compared to what a lot of the corporate accounts pay. If you do a comparison against corporate, public sector pricing is very aggressive and very attractive.
Well, and it is, what's interesting about it, and Kristen's got to follow up here in a second. What is interesting about it is that pretty much every hospital has an enterprise agreement with Microsoft and has some form of vendor of record pricing agreement with Rogers. And so this is actually a pretty easy lift. Kristen, follow-up question.
Yeah, I was just going to make a comment. No, I do agree, especially compared to some list price, we do have it good. It's the cost compared to today's cost for calling, for example. So for us anyway, what we've looked at, the cost does increase. I'm kind of liking what you're saying about those personally owned devices, but the only thing now, like if a personally owned device user, a doctor, consultant within a hospital, leverages the vendor of record, who's now paying for that? Are you letting like an end user leverage that $20 a month pricing, or now does the hospital have to scoop up that cost?
So the easy answer to that is no, the end user can't. The part of the agreement is that it has to be an organization. So yeah, so it's a very good question. In some cases, the doctors, well, in all cases, the doctors are paying for their own phones, and in some cases they operate a small business, and so they, it's a deductible expense for them. In some cases, hospitals provide reimbursement. And in a case where hospitals provide reimbursement, that's certainly a situation where it's really still the hospital's bucket. It just reduces the cost. But yes, that's a very valid point.
Yeah, well, and that's fair for doctors. I do know we do have sort of chargeback, or they purchase services from us. For the rest of like the regular Joes, today they're paying for their own phone. So if we had to bring them onto our plan, we're now incurring that cost that we didn't have before.
Yeah. The interesting thing, and we talk about the mobile devices, the center of patient care, and the discussions we have with CIOs and healthcare are the concerns going forward. If that device is becoming used for more and more activity within patient care, how do we ensure it's locked down, managed, and so on? And can we do that when that device is an individually owned device versus a corporate owned device? And what kind of security do we need around it? For instance, David McDougall on this call, who's our healthcare account executive and formerly a radiology technician, has shown some radiologists how we can use devices and portable radiology devices to take unbelievable scans that we can show on mobile devices. But then the question is, once you PDF that and start shooting that around, what's the responsibility and accountability of the healthcare organization to make sure that that data is locked down, because it's patient information? And those are the kinds of conversations that we're having with clinicians and CIOs right now to talk about how, as that mobile device becomes a greater point of the center of patient care, how do we ensure that the data remains private in Canada, secure, and all that kind of stuff.
Yeah, the data breaches. And, so Christian, just for our use, so Microsoft, I bring my own device, I pay for my own device, but it's a corporately managed device. And all my calls go through data, right? So long distance is gone. It's all data. And our costs have gone way down from our telecommunication costs because of that, right? So again, if you look at all the hospital and what you're spending for long distance, maybe all that's shipped over to VoIP already and it's all data, but the cost drops significantly. Like the data consumption is pretty small when you think about the total cost, right? So
it's good dialogue. I don't see any other questions. Is there anyone else with any other questions? We got a few minutes. If not, just say thank you again for joining. Happy to have further dialogue with you. This is an interesting area. It's an evolving area. We love being at the forefront of it. We love being partnered with Microsoft on this. And so we're more than happy to sit down and talk with you about this. We're also, Grant, cover your ears. We have the ability to deliver pilots where necessary in order to test this out. So, and we're happy to do that if necessary. So thank you again. We appreciate you joining us and being part of the dialogue, and we hope you have a great rest of the day.
Okay.
Thanks, Steve.
Thank you, everybody.
Thanks, everyone, for joining.